now. There we are. Okay, so give me one moment here. I want to say a big welcome. Thank you for all of you for joining us probably on your lunch hour. And I want to say a big thank you to Dr. Robertson, who is here from Johns Hopkins School of Medicine. And she's an assistant professor of medicine and the associate program director for the Geriatric Medicine Fellowship Program there. And so I will hand it over to her and I will monitor the chat for you.
Thank you so much, Dr. Townsend. It's so nice to see the group here with us today. I'm so glad to be with you. I'm in Baltimore, so a little bit different time zone here, but so glad that you're all able to join. I know lunch hour is a complicated time, so enjoy your lunches and hopefully we can learn some things together today. I will ask if you feel comfortable. I don't mind watching you eat. You can put your video on. Also, if you don't want to turn your video on, I do ask that you consider engaging in the chat with me. I have a couple spots throughout my presentation where I welcome your perspectives. One of those being right now, if you don't mind, just chatting the level of learner that you typically work with, just kind of where you're doing teaching and what that looks like, because that'll help me think a bit about the feedback you might be giving as I'm presenting. So I'll go ahead and pull my slides up while you all just quickly introduce yourselves in the chat and the kind of learners you work with. And I'll let those trickle in. I'll go ahead and get started. Hi.
I can come on video and share. I know it's always nice to have folks on video when you're trying to do a session.
Thank you.
So I work with the majority of first-year medical students in a large colloquium setting with where there's about 130 of them. Not always all there, but it's
Sure.
a large setting typically.
Great, thank you. Thanks for sharing.
Mm-hmm.
And it sounds like some of you I see in the chat work with all level learners in medical school. Amazing, yeah, lots of different learners. Great. Dr. Townsend introduced me. I am on faculty in the Division of Geriatric Medicine and practice largely home-based medical care, though also do inpatient work, both with my fellows and with resident learners, and host medical students in my outpatient home-based medicine practice. I also am core faculty for a longitudinal teaching skills program we do for our faculty. And a lot of what we do is talk about these kinds of concepts with our faculty around teaching and building communities of practice for our co-faculty as well as for our learners. And one of the big topics is around effective feedback delivery. And I have to give the first disclosure, the only disclosure I have, which is that this is a humongous topic. So I hope today that this will just be kind of an introduction and I will give some frameworks for thinking about how to deliver feedback for your learners, but I think there's a lot more delving in that can happen. And I'll share some resources that we have available online for free that will allow you to delve into that a bit more. I have no financial disclosures to disclose. And I'm going to keep the objectives relatively simple. I want to first just sort of set the stage for providing effective feedback and some of the principles and steps to doing so. And then I want to give you two models that I've found to be effective for providing feedback in a dialogue way that allows you to really connect with your learner. I hope those models might be helpful for you. I'll start with a case only to sort of give some context for a situation you might have to deliver some feedback around. So many of you work with medical students, but you're working in clinic with Dr. S, or it could be also a medical student who you've observed on many occasions, perhaps in a longitudinal setting, and notice that they have difficulty explaining medical issues, the treatment plans, and use jargon, have trouble kind of helping their patients understand benefits and complications for treatments. You have some issues specifically around their ability to have a meaningful shared decision-making with their patients. So that's the clinical context, an example of a space where effective feedback given to this learner will help them gain some mastery in this. So what is feedback anyway? It's good to have a shared definition so we're all on the same page. It's really a transfer of information that describes a learner's performance that's utilized to help them grow, right? To maintain skills or to modify things to help their performance. It's supporting cognitive, technical, professional development with the goal of hopefully mastery over time, right? So I love the highlighting of information, right? It's a sharing or a dialogue of information. And why is it so important? For many reasons, both because if mistakes go uncorrected, the learner can make assumptions and that can lead to trouble reaching mastery, but also if we aren't providing feedback, we also miss the opportunities to reinforce the ways in which our learners are positively doing things so that they continue to do that. And that also causes them to have assumptions about their ability to do things if we aren't reinforcing the things they're doing well. So this isn't just about providing the hard feedback, right? This is about all feedback and the ways in which we can utilize it to help our learners be masters. So we all agree feedback's important. You're here with me today, so you at least thought it was important enough to eat your lunch with me and talk about it. So why is it such a struggle to give the feedback? And why do you think learners struggle to receive it? I'd love for you, if you don't mind, to type in the chat struggles you've felt with either giving or what you think your learners struggle with receiving feedback. I'll give just a couple minutes or a few seconds here for y'all to type in the chat. Or unmute yourself if it's easier to speak. Yeah, so hard to deliver feedback in a way that's positive. You don't want to sound critical. So you worry about causing the learner to feel badly by giving critical feedback. And how do you spin it in a way that's easier to receive? I agree. Not wanting to make someone feel bad or shamed. Exactly. Yep. Yeah, those are two key reasons a lot of faculty cite.
I'll toss this in. I teach writing, and so it is a little bit different probably than some people here. But that's my area of expertise in instruction, one of them at least. And then for me, I am almost always wanting to have bigger engagement around the writing because there's a lot of nuance that I want to communicate. I find it very difficult to give feedback. I'm limited by time and I'm limited by space. And so I would much rather have a conversation with the student because then I can do it. But often when I can't do that, the mode for me can be challenging and difficult. And sometimes the student doesn't want to hear all that I have to say about their writing. They're just like, just score me and move on. And like, so.
Yes, those are, you highlighted so many examples there, both on the side of the person giving feedback and also the receiver, and challenges that arise with that exchange. Great, thank you for sharing that. These are all things that have been cited in the literature as we think about ways that it's a struggle to deliver feedback to our learners and to receive feedback. A lot of teachers, educators, instructors will say lack of time, confidence, or skills around that, feeling like there aren't the opportunities to really observe if you're actually in a clinical setting, for example, observe and give active feedback around behaviors or activities. And this concern that you all highlighted, which is giving negative feedback and how hard that can feel. And for the learners, there's often the concern that it's not frequent enough. It's so interesting. I've found as I've been doing this more that you have to actually say, I'm giving you feedback now in some way, like name it as feedback because you may be giving it and a learner does not recognize it as feedback, right? So sometimes they'll say it's not frequent and I feel like I've been telling you and giving you feedback throughout the time I've worked with you, you just aren't seeing it as that. Sometimes it's that they feel it's ineffective, it's not useful in a way that they can apply. And they'll even say, I desire it, but I also fear hearing the negative stuff, even though I really want to grow. And credibility is critically important. What I mean by that is there's actually pretty good data to suggest that learners really need to believe that the person giving the feedback actually understands what was going on in the situation. So one of those things being that they actually observed the thing and it's not like secondhand information they're giving feedback around. So that helps preserve some credibility. I appreciate Jessica added here that giving feedback, trying to figure out where they are developmentally in most appropriate ways to give feedback exactly. And then receiving it is defensiveness and perception of feedback being a minimization of their efforts, right? Like that they feel like this is you telling them something is wrong or that they aren't working hard enough. Thank you for those pieces of feedback or those examples. So one of the key things I kind of want you to take from today is that moving away from this idea that we own all the information as the feedback giver and that the learner is the receiver and it's a one-way dialogue. Instead, this being more of a relationship-centered approach to thinking about how we share and grow together. And I think that helps to shift the mindset a bit from the beginning. So how can we move from me delivering feedback to you, learner, rather, how do we make this more of a bidirectional communication? So let's start with sort of a scaffolding here. I think one of the most important things is to establish a safe learning environment. So as I said, I do a lot of my work in the hospital setting or in the outpatient home-based setting. And so much of when I think about how I'm going to give feedback, I think about how I build both psychological and physical safety for my learner when I'm giving this feedback, right? So psychological meaning creating a space where growth feels important, where mistakes are not highlighted as a negative, but rather I tell you as the attending from the beginning, like where I've had troubles or where I'm struggling in my own growth areas as a means of highlighting and promoting the fact that we're all growing, we're all still learners, and there is no reason not to highlight and be passionate about understanding that we all are in a space of growth, rather than this idea of a fixed mindset, which I think particularly, unfortunately, in medical training, I think we've often create an environment where people are afraid to talk about the things that they don't know for fear of being made fun of or for fear of people thinking that they don't know what they're doing. And failure can limit their ability to be successful, right? So facilitating psychological safety through growth mindset, modeling that as soon as you begin to work with a learner to help create a safe space. And the physical actually matters a lot, even though it sounds kind of strange. And safety meaning like where you're giving the feedback, how you're giving it, and what the timing is, so that it doesn't create a place where that learner might feel, oh, this is uncomfortable. I don't think I can receive feedback in this environment. For an example would be a busy emergency department and you're giving it at the nurse's station, or if you're teaching around a bunch of other medical students, giving the feedback in front of their colleagues in a way that might make them feel demoralized or embarrassed. So physical environment actually matters a lot as you're planning where you might want to give feedback. I love this. So I'm a big medical Twitter fan, and I will share at the end why I think it's a great space for you to learn as an educator. But Dr. Greg Stetson is an educator who shares a lot of his own work in this space, and I'll link you to it at the end. And I love this table that he shared on Twitter recently that showed how he built psychological safety for his team and a growth mindset as he was building his evaluation and his planning for his feedback with them. So at the beginning, he talks about, I don't care what you know right now, right? Like, I don't care where you're coming into this. You don't have to know a bunch of stuff. I just want to kind of see your baseline and then see how you can improve while we're working together through hard work and incorporating what I share with you. So focus on the process, right? Instead of the result. It's not about how much you know or what you know, but how you've taken what I've given you feedback around and improved over the course of time we're working together. And then, like I mentioned before, modeling growth, right? So I'm working on being the best ally and upstander I can be. So telling your team I'm working on, or your learner, I'm working on these things. I would love for you to tell me if I've missed an opportunity to do this thing. So acknowledge my own weaknesses, his own weaknesses, and offer and allow the learner to give feedback to him as well as a means of making this more bidirectional. And then also provide a way that he's incorporated his feedback and his own feedback he's received in his own practice, so that it also models like, okay, receiving feedback and how you're applying it. It shows reflective practice. It shows that you've really taken something and tried to change the way you practice. And that highlights for the learner the ability to receive some challenging or maybe negative feedback and modify around that. So these are some ways. Don't have to do all of these, but some ways that we can model and create a psychological safety around feedback before we even begin to give it. And also, I just want to leave a quick note here about always coming to every encounter with your learner with an examination of what biases you might be bringing to this space of feedback, right? So what are the assumptions you have about that person that you're working with that might bias or change the way you give feedback? And try to shift the way you approach and take more of an appreciative stance, assuming always good intentions. One of the models that I'll share in a bit, the kind of underlying tenet is that we assume good intentions from our learners when they're coming into spaces with us, even if they do something we don't necessarily agree with. It's assuming that their intent wasn't negative. It's just that they didn't necessarily know the right way to do something. So let's get some further scaffolding here. So I have some basic fundamentals I think are critically important to think about. I want you to begin to think about feedback as love, as like a way that you're showing care for your learner. That means shying away from it means you are kind of shying away from the ability to help them grow further. And that it is not the same thing as evaluation. So every time I work with a learner, I get this ping at the end of my time with them that's this like online evaluation, and I check a bunch of boxes and sign like what I think they did throughout the block, right? That is kind of an end of the block evaluation. And never on an evaluation should there be anything that they haven't already heard about sometime through the time you work with them, right? And so that's the key part about feedback. Feedback is kind of regular input that allows them to grow and improve, so that when they see the evaluation, they're not surprised by anything you've shared. And it's a direct reflection of the feedback and the things they've done in response to it along the time working with you. It's really important, and I highlighted this a little bit earlier too, that it's, you base your feedback on direct observation and actionable behaviors, not things that someone cannot change about who they are or themselves, right? And it's things that you actually saw, not things you've heard about. That really is critical. I say timely and specific in targeted feedback. I say timely and specific, except for it should not, again, keeping in mind the psychological and the physical safety of not delivering feedback in a way that might demoralize someone, right? But timely and specific, meaning closer to the time that something might have happened that felt like it needed feedback, helps them to tie that to that thing that happened, right? So when we wait weeks and weeks on end for feedback to be delivered, it can sometimes lose the effect or impact that we'd hoped for when the event happened. And I think to go to what Dr. Townsend was saying, that sometimes we don't have time in the moment to give all the feedback we'd hoped to, or they're not, maybe in the space to receive it. It doesn't always have to be a verbal feedback, right? So another example being, I work with learners sometimes in a primary care clinic I have in the past, and it's so fast paced. There's just like very little time to give like very thorough feedback in a moment. Sometimes in an email exchange with a later meetup for a more formal feedback can help at least start the conversation. And always trying to, again, approach with curiosity, assume positive intent, and use as much non-judgmental language as possible. To really set yourself up for success, and we'll move to the models, the frameworks I mentioned in a moment. But I think really helping, set your learner up for success is to start out the beginning with goals and expectations. For example, Dr. Stetson's goal of, I don't really care what your knowledge is right now. I care about what your goals are, what our goals are together, and how you move with the feedback forward in the next 2 weeks, right? So setting expectations and goals early helps your learner have a roadmap for success. And encouraging them to set goals for themselves with some guidance from you so that they can really lay out the things they're working on, and you can bring those goals up throughout with the feedback you're giving. And prepare and give them time to plan for feedback, especially if it's a planned feedback session that you're hoping to deliver. For example, if I'm on a 2-week block on the wards, I will let them know at the very beginning, around the mid-block period, we'll have a feedback session where we'll talk about these things you set goals on. So they're ready, they know it's not something that's surprising them out of the blue. Always kind of explore, and I'll go into models of this in a moment, their self-assessment. They'll, allowing them to sort of say how they think they're doing with the things we set goals around, so that they're involved in the discussion. And always think about whether, I think, again, to kind of create this environment of bidirectionality, recognize that you are not the holder of all the keys. No one person holds all the keys or all the answers, but that the learner and their alternative perspectives are critically important. Make sure they understand what you've delivered to them as feedback, and that includes naming it. And always plan for some level of follow-up, because what we're talking about now is more formative feedback throughout the time you're working with someone. So some follow-up to allow them to grow from what you've shared. All right, so now let's get to the nitty-gritty of the models that you can use in your own feedback. The two that I'm going to share today is the ask, tell / share, ask model, and debriefing with good judgment. So these are two that I hope will resonate and you'll be able to use. Both of these models focus on relationship building and the teacher-learner relationship, so that psychological safety that comes with building trust within a team or within a relationship of a attending or instructor and a learner. So it promotes credibility and trust, and they both emphasize context. So who is the learner, what's their role, and what's in the situation. Oops, I gave it away. Go back. Okay, so what's the feedback sandwich? Does anybody know? I think I gave it away already. Can you type in the chat, or someone want to speak out loud? Has anybody given a feedback sandwich to someone or received that delicious sandwich?
I think I have been doing this. I don't know whether you can hear me.
I can, yes, thank you.
Yeah. So that was the feedback that we were told to give, like in our initial training, that, okay, you try to give a kind of a sandwich feedback. You start with excellent things, what they did great. And in the middle, you give them some things that you need, they should improve on. And then you end this with something which is kind of, again, a good thing, to end.
Yeah.
Feedback. So I don't know, the effectiveness of sandwich feedback has been criticized a lot, right? So I really don't know, is it effective or not?
That's a great, thank you for sharing. Yes, I love that you're asking that question. I'll talk a little bit about what I think about the feedback sandwich. I wonder if anyone else has had it, knew they were getting it, given it. Yeah. We'll let it ruminate. You can type in the chat if you've had the sandwich delivered to you before. At lunchtime, it's so apropos that we talk about sandwiches. So yes, you're exactly right. So the feedback sandwich is the idea that we squish some criticism between two pieces of praise, and we deliver it to our learner in the hopes that it'll maybe soften the blow. Maybe it allows them to feel a little better about whatever, in the middle we're delivering. There's a lot of reasons people have thought this might be a way to deliver feedback. And I think I'm going to propose a better sandwich that you can use that will still deliver the things you hope to deliver. Some of the things that are challenging about the feedback sandwich is that it's unilateral, and it's kind of you feeding to the learner, right? Like you're giving them this thing. It's a one-way flow of information, as we started from the beginning talking about. It puts a lot of onus on you to sort of figure out what those two good things are and how you're going to put the hard thing in between them. It has a Pavlovian effect, meaning we all have, I've been the receiver of the sandwich on many occasions, and that last good thing is probably it may be trite, I should say, or that it's coming, it's coming. You're not sure, oh, great, I think you just said this because you're trying to make me feel better about that baloney in the middle that you gave me, right? And in some ways, it can limit the worth of positive feedback, right? So because of that, because a learner might be like, oh, here comes that positive you felt you had to give so that baloney didn't taste so bad. It makes the learner feel like you might be manufacturing the positives, and it may negate the message. And it also teaches us that middle part, that it's bad, so bad that we have to kind of to hide it so that the learner doesn't really recognize they're getting it, even though often they do. And so I'm going to propose a different approach that is still a delicious. Look how good this sandwich looks. It's so much better than that old bologna. It's the new feedback sandwich. And for the vegetarians in the room, this can be veggie meat here. It's the new and improved feedback sandwich called the Ask, Tell, Ask model. And what this gets at is the idea that we do not hold all the keys. Again, it helps us as the faculty member, as a person giving the feedback, to allow the learner to guide the boat a little bit, right? So it starts with an ask. Instead of you starting with giving them information, you ask them to self-assess their performance. And especially if you've started the beginning of a time together with some goal setting, hopefully they've already begun to think about the things that they're trying to work on that you are going to help them with. So what's going well with this time together? What do you think has gone well? Were there times that you felt like things were a struggle? Or what are some things that are not going as well? So let that learner begin to tell you, I'm doing these things well. These are things I'm struggling with, and push them to also be sure they're saying the things that they're doing well and highlighting those, right? So for example, the learner might say, gosh, I'm struggling to get all my patient care tasks done, and I'm not sure how to prioritize things. Okay, great. That is such an important thing. And I tell you, like, especially with your insightful learners, but with many learners, the thing they share, the struggle they have, is often at least adjacent to something that I've had on my list of things I would like to give feedback around. So it usually opens a door for me to be able to give some feedback around the thing that they're also recognizing to be a struggle, right? So then tell or share, right? This is where you get to say, yes, I love that you highlighted that you are like patient bedside manner has improved. I totally see it. I see the way that you're looking at your patient in the eye, you're getting down on their level, you're, highlight the things they're doing well and say, I also noticed, I like that you mentioned, or I'm glad you mentioned this struggle with patient care tasks. Would you mind if I shared some things I've noticed around that? I've noticed that your notes aren't always complete till late, and I worry that that might mean the consultants aren't able to have the information they need to be able to provide care for the patient. So I like the language like I noticed, or I've seen. Would you mind if I share this piece of information I've noticed that's adjacent to what you said was a struggle? So you're offering them some things you've seen directly that ties to what they've identified. Ask them, what do you think we should do to help you with this, right? So you've had a conversation, these are abbreviated dialogues here, but say you've had a conversation a bit about this patient care task issue, what you've noticed about the notes, and then you can ask them again. So, okay, great. This has been a good conversation about what you think's been a struggle and what you're doing well. What do you think are some next steps that we could have to help you improve on this? And what do you understand about what I've shared with you? And allow them again to guide how they want to move forward, right? So they're the ones driving this ship. They've given you some ideas, and you also can share more here, right? So yes, like maybe would it be okay if I offered some suggestions in addition to the things I think are great ideas for you? So sometimes what they'll do is they'll overcompensate and bite off more than they can chew in their own planning, right? So helping them to create actionable goals. For example, in this situation, say that they said, I think I need to just do better about prioritizing my to-dos after rounds by asking my resident and making sure that I get my notes started earlier in the day. And say, that's great. I completely agree. I think those are great goals to have. Let's check in after X number of days and see how these two actionable things are going. So this feedback was really very bidirectional. And when it goes really well, the learner is doing a lot more talking than you are. And it also takes a lot of the onus off of the person giving the feedback to have like started the conversation and delivered what we think is a challenge from the very beginning, right? Often it's adjacent to what they bring up themselves. How does that sandwich taste to people? I'll let you ruminate on it. One of the questions I have about it is, what about your learners who lack insight, right? So this is a great approach for your learner who's really able to say, like, this is what I'm struggling with. This is what I'm doing well. In fact, those learners with insight, like, it sounds like you'll taste the whole sandwich, not get caught up in the bread. Yes, exactly. We'll get to that good stuff in the middle there. That is really rich, right? Yeah, exactly. I love that. I think you're right as learners. And I think that it is important that we guide them, because a learner would not, if you just started out and said like, okay, tell me the thing that it's like, really, what do you think's going well? What is the struggle? And that first ask might take some teasing out a little bit about what they actually think's going well, and maybe even some specific questions, right? This is could be a very nuanced conversation. I think one of the things I struggle with is some learners, some of the ones that struggle the most, right, are the ones that have the least insight into what they don't know, right? They don't know what they don't know, or they're the overconfident learner. So they feel like they're doing quite well and like don't really think there's a lot they need to improve upon, right? So what about those learners? I think that's important to think about, right? And I think this next model, or this next guide, is a little bit more tied into that type of learner. And also for those of you who might teach skills like procedures, this is a piece of feedback, an approach to feedback that might resonate with you. This is the Debriefing with Good Judgement model. For those who haven't heard of it, it comes out of actually the world of anesthesiology. but has been very applicable to many different areas in medical education. The goal overarching is to give critical feedback. So for some of you who said like one of the things you struggle with feedback is giving the hard feedback without like making people feel bad, right? So one of the big goals of this approach is to provide especially critical feedback without creating negative emotions and maintaining relationships with your learner. So the main assumption underlying this that you really have to continue to challenge for yourself is that even when a learner is doing things that feel really frustrating or feel really off base, they mean well and they're trying to improve. And the focus is really getting at what the learner's frame is. Where are they coming from? And how do I help shift their frame in the future so that they come from a different perspective after getting some feedback? Okay, so the goal is that we try our best to understand what their perspective is when they're coming into the situation and how can we help shift that perspective through dialogue and through communication. The process to shifting perspective or shifting frame centers around curiosity with the goal of inquiry and advocacy on behalf of the learner, trying to really uncover where they're coming from and how we can help them grow. And it also, which I love, and I've become a massive fan of, it encourages the learner to be reflective, to think about what happened and how they can potentially change or move the dial the next time through. Not punitive, right? But recognizing the errors or challenges and flaws in ways that that can be shifted for the next time, because they're learners, right? They're in training. And so we cannot expect mastery yet. We have to give them many more opportunities to reshift that frame and to do things differently. So this is the model. I wanted to give the background first, but this is this is the framework that I'm talking about when I mention the frames, the actions, the results. So the frame is invisible, right? It's kind of in the mind of the trainee. I want to highlight here too, though, that we bring frames to our interactions too, right? And those frames may not always be accurate either. And so it's important in this kind of thinking that we're not just trying to uncover the learner's frames, but we're trying to acknowledge what ours are as well, right? And finding the way that we meet in the middle. Actions are observable. So the frame kind of guides how we act. Actions lead to results, and those results may or may not be what we'd hoped for. And if they're not what we had hoped for, debriefing using inquiry, reflective practice, and advocacy allows for changes in both actions and frames in the future. Okay, hopefully that kind of makes sense as we look at it as a framework, and I'll talk about it with a bit more detail. So just to hammer it home, kind of the tenets of this debriefing with good judgment are 4 things. The idea of reflective practice. I know this is small. I'll let you have my slides. I love Cobb's learning cycle, which is a guide for reflective practice for your learner. So an experience happens. What happened? Why did it happen that way? What can I learn from it? How do I improve? This kind of cycle of reflection. And that is part of what we're trying to help a learner work through in this model. What happened and why do we think it happened that way? How can we do this differently next time if it wasn't what we'd hoped for? A debriefing stance. We are not punitive and we do not hold all the keys, remembering and being humble that we are coming to this with our own frames and balancing mind and heart. I love this cone in the box for so many reasons. This again brings the idea that we all have a unique perspective and that this model recognizes that we're both coming at things with different perspectives. The learner might be at spot A, and when they look in the box, they see a circle. I might be at spot B. When I look in the box, I see a triangle. Together, we recognize that it's a cone, right? But neither one of us is right on our own without working together. So that's kind of the underpinning of this model. And just some language as we're thinking about how we advocate for our learner in this model of feedback is around kind of inquiry and advocacy. I wonder, I'm curious. I think I saw, I noticed. So here's a concrete example so that you aren't thinking I'm just cerebral in this in this medical legalese is medical language. Advocacy and inquiry. So you're seeing a learner who's doing a knee aspiration, for example. They're trying to take fluid out of somebody's knee using a needle. Advocacy and inquiry is noting the action and the result. So you're trying to get to like, okay, I saw what happened. I saw the result. what was the learner thinking? I noticed, you say, I noticed the needle was inserted before the anesthetic, before the lidocaine took effect. That was the action. You inserted it too fast. And that joint aspiration was more painful. That was our result. So how do you decide when you want to insert a needle? That's your inquiry, right? You're trying to get to the bottom of what's going on. And the learner might say, well, I watched another attending do this once. This is my first time doing it. When I watched someone else do it, they didn't use anesthetic. They just did the injection. They just did the aspiration. So the other attending, that was how I learned. Okay, great. That's helpful context. This is a very simplistic example, but I've gotten to the frame here that this is like what they've seen other people do. So let me debrief a bit. It sounds like you've seen it done a different way. My experience has been that inserting a needle without local anesthetic that's adequate can cause pain and may cause the patient to move, can make the procedure more difficult or less effective. So let's discuss steps for a quick, less painful, and more successful joint aspiration based on my experience. And then bringing in the reflection and reinforcement. So, they might need to reflect a bit more with you about what went well and what didn't. And then you can talk a bit about how we reinforce this. So I want to help you shift your frame, right? To see it done in a way that doesn't cause pain and that has a positive outcome. So let's go back and see some other patients on service that need a joint aspiration, let you approach these. How would you like to approach them? And let's review them together so that I can see how you do it. So the frame, the other attending inserted the needle quickly without local anesthetic. So my action was to do the same because that's what I've seen. The result was an unsuccessful aspiration and pain for our patient. And through inquiry, through debriefing and reflection, we've come to sort of an answer of thinking about how we might do this in a way that's both successful and causes less pain for our patient. So hopefully, and again, the first time this feedback's delivered, it may not change the frame, right? But the key being that we continue to discuss the steps for how you might do this differently, and we practice in other scenarios. Does that, I guess I'll go back there first before, does that resonate at all with anyone? Oh, yes, I see something. Oh, that was different. Okay. Does anybody have any thoughts on that model? So you'll get a copy of this original article, which I really love, that highlights this framework with some really great examples of ways that they've used this in higher stakes scenarios where feedback's needed to be given. I kind of think about this model as one where we really need to give the feedback pretty quickly, or it feels like it needs to be delivered and it's going to be harder feedback to deliver. For example, a patient outcome is negative and the learner needs to kind of think about or identify the frames that they came to this encounter with and see if we can work through them together. So I think the article, as you read it, might help you also see other scenarios where this might be useful. But I find it to be one that I would use more on the fly in situations where I see an outcome that's like, okay, oops, we need to really catch this sooner than later. The ask, tell, ask might take a little more time, but we want to sort of get to the frame of what you were thinking here and be able to deliver information that they come to as well through reflection as well as your own feedback. So let's just quickly go back to our original scenario. If you remember, we're working with our learner who has some trouble with jargon and with shared decision making. And we can think about this now through the lens of a couple of the two models that we shared today and how we might begin the conversation with Dr. S, right? So it could be, given this is something you're observing on several occasions, that you've set an expectation for some feedback. And this might be a wonderful opportunity to incorporate the ask, tell, ask approach, where you ask Dr. S to share a bit about how they think they're doing, right? Additionally, it could be a good place to use debriefing with good judgment to sort of gather the frame that Dr. S is bringing to the encounters with the patient and whether they feel, for example, perhaps the frame is that they don't know that that's their job to really be engaged in shared decision. Maybe they defer to the attending for some of these things because they're afraid that it's not their role, or, you really don't know what they're bringing to the space until you allow them to reflect a bit with you. But I love for this one in particular, if you're following them over time, the ask, tell, ask allows for you to come to some conclusions together that they can grow from and you can observe if they're in a longitudinal scenario with you, for example. But these are just two tables kind of showing you how you can use the framework and you can apply it for your own feedback. So in summary, quickly, because I want to show you two tools or two areas that I think you might enjoy to use later for your own learning. But learning, I really will hope that when you leave this talk today, you recognize and think about the environment and the relationship building with your learner as key to effective feedback, even more so than tools or models or frameworks, right? But really the act of creating a safe learning environment for your learner and building relationships built on growth mindset and humility that we also don't know all the things and that we're all working together to grow. I hope that you can utilize some of the tools I shared to assist with creating a feedback dialogue. And again, this is a 1-hour talk on a very, involved topic. And so I don't anticipate you'll leave here today and be like, you magically great at these two models in any way. Use kind of like without practice, they can be hard and may not feel like they're as effective as you'd hope, but some of this is around skills practice and just trying it, right? Trying it out and seeing how it works with your learners. I am going to make you engage in some reflective practice. If you have in front of you any way to write or even if you just want to think in your mind. I love the 3-2-1 approach to reflection after a talk. And I've begun to do this for myself with any talk that I've listened to sort of create some reflective practice of my own so that I summarize how I might actually apply what I've learned. So thinking about 3 things that you've learned that you didn't know before this talk, 2 ways that you'll apply it in your own teaching, and 1 question you might still have that you need to look up on your own to help you solidify it a bit more. And if you have thoughts or want to say anything out loud, I also welcome that.
So can I start from 1?
Yes, you
Can
don't
we
have,
go
yes,
1 to 3?
absolutely.
So my question to you is like, I have 2 questions. So that has always been very difficult for me to give a feedback in a way that it's positive and it's not hurting the person, right? And it's not taking away the confidence, So I want to ask this question to you. What kind of feedback you like to receive? Is this a sandwich approach, or you would like to receive straightforward feedback? Like just 1 question is this: what kind of feedback you would like to receive? Another question is that I've been working on this thing that if you just focus on the strengths of other person, then the strengths grow. People feel more confident in an organization and then they grow in their strengths instead of making them all the time realize their weaknesses if they're not crucial. And then, okay, focus on your weakness, and then they waste most of their energies on their weaknesses, right? And then their strengths are left behind, kind of. That is another thing that the philosophy I have been struggling with. So I would appreciate, and that was an excellent talk though. Thank you so much for coming and giving this talk.
Absolutely. I wish I were coming in person. That would be so much more fun. But yes, thank you for those questions and for that that honest feedback and thoughts around this. So I personally love to receive constructive feedback as a learner. I've always felt that way when it's delivered in a way that feels like it's meant for my own personal growth with follow-up built in, right? So delivering difficult feedback without any sort of way to help someone move the dial in the positive way forward is really challenging. I'll give an actual example from today. So I had to present, I'm going to be, as a faculty member, asked to present my kind of work to the whole Department of Medicine, including the chair of all of medicine here very soon. And they had us do a dry run today in front of really important people. And I had to get up and do this kind of ill-prepared, not completely done presentation. And at the end, they gave very critical feedback. That was part of this whole process, right? But the thing I appreciated most, so my 2 mentors that are senior educators, both of them, the feedback was given in a way that allowed me to then meet with them in another week to sort of run through my presentation and hone it a little better and practice with them and then prepare more and get better at what I was doing. So with a plan, right? Not just this really was awful, but like very constructive things that help me improve and a plan to get better, with them being willing to take the time to watch and work with me. So I love that, actually. And I think learners crave that, even though they fear rejection or fear that they're not going to get the follow-up, right? I think the fear lies in not having a way to improve or a pathway forward. And I think the thing I love about both of these models that shifts my thinking about this a lot, has really been transformative in the way I think about feedback, is that especially in the ask, tell, ask format, right? The learner's guiding it. And so they're actually the ones identifying their grows and their glows, the things that they want to grow on, the things that they're doing well. And one of the biggest parts of ask, tell, ask that I think you really need to remember is the part of sharing and highlighting their glows. And often what I have to do is say, you didn't say enough good stuff about yourself. When I asked you to share what you think's going well, I love what you said. And also, you're doing so many good things, right? And in that first picture where I showed you to map, like kind of the challenges with not giving feedback, one of the biggest things when we don't give feedback that's good in that reinforces things that are going well, is that we also teach our learners that they're not doing a good job, or that no one's telling them the things they're doing well. So I totally agree that giving the feedback around strengths allows people to highlight those and grow on those, and allowing them to identify the areas they can work on, and then enforcing that for them just allows them to know that you're there to help them and they're not alone and just sort of scrambling to figure it out. It's a long-winded reply. I loved your questions. I think those are things I still grapple with myself a lot.
Thank you so much. That was very nice. Thank you.
You're welcome. I want to share 2 resources quickly with you. I think I have a couple more minutes. I'm okay on time. Okay. So at Johns Hopkins, we have the Institute for Educational Excellence that has a bunch of free resources for educators around improving teaching. And so we have a website that you can access. You can actually get CME for doing some of the things on this website as well. So that part, I think you pay us a nominal fee, but you get CME credit for the things you do. But let me take you there just so you can see what it looks like. Let me share my screen. I had it pulled up already. Just a second, sorry. Here we go. Can you see this okay? So this is the IEE website that I mentioned. And it's really, really rich with opportunities here. So, I'll bring you to the assessment and evaluation section only because that's, where we've been focusing today. But I will tell you, there's all kinds of things around teaching methods and ways to improve your teaching. And it may take a minute to get us there, but within here, there's a whole part on formative feedback. Here we go. And it talks through some objectives on how to give high quality feedback and preparation. There's a video here from one of our leaders. He talks about the two topics I shared with you today with a little bit more detail. And it also has ways to apply this and use it in your own practice. This has a formative feedback assessment that you can do for some CME credit if that's of interest. And as I mentioned, I love this site also for some of the other resources it provides. Like, I love this. It gives some tips around how to do some innovative ways to teach, like the flipped classroom, 1-minute preceptor, teaching procedural skills, how you run small groups or like lectures in ways that are effective. So I wanted to share that with you because I think it is a great resource that's free to you to access. Additionally, I'm a MedTwitter fan. I love learning from people on the Twitter sphere, not all of Twitter. Twitter in itself is behemoth and I don't love it. I would love to come back and talk with you about how to use Twitter to your benefit from an educational perspective, but I'll start by giving you a little teaser, which I will also send the link. The link will be in my PowerPoint, but there are whole groups that create threads and feed on various medical education topics. I linked in specifically the one on feedback, but it's a group that's called the Meta Twag Team, or the Twitter tag team of faculty members across the country. This is Dr. Stetson that I mentioned, I referenced earlier, talking about topics like feedback. So he's created several threads on different parts of feedback. As I mentioned, it's such a huge topic. And so there's a lot of different things you could talk about within feedback, but they have a thread on the introduction to feedback, a thread on the culture and the setup. So what I talked about a little bit around the environment that you create. They have things on the components to feedback, on methods, in more and more. So formative, some of the things we talked about today, and summative, So it's really pretty amazing, and how you give feedback in a written form instead of a in-person form. So this is another thread that's linked into my PowerPoint that you can also access, that allows you some more connection to resources and maybe lets you dip your toe into the medical education side of Twitter. So I don't have a lot more to add today. That was the main content I had to share, and some resources that you'll hopefully find helpful as you carry some of this into your practice. Dr. Townsend will send you my email address. I'm very happy to communicate further if you have questions or would like anything explained further. And I'm so grateful for your time and attention.
Thank you.
Thank
Would
you
it
so
be
much.
okay if you share these websites link in a chat?
Sure. Yes.
I am actually going to be sending an email to everyone who is
Yeah,
attended
would be
today
perfect.
with those materials and links, and that will go out momentarily.
Thank you so much. Thank you. Lovely talk. Thank
Yeah.
you.
I also just want to ask that everyone, if you could just take 20 seconds before you leave, click this link that's in the chat for our feedback survey, and then you can head out. I'll also include it in the email I'm sending. So thanks so much, everyone.
Great. Thank you.